Hello everyone, welcome to Visan's Anatomy. Today we are going to learn about the ABCD of anatomy, nothing but the basics of anatomy. These are the basic terms which we use in anatomy to learn about the human body. We learn about the positions of the body. There are different positions to keep the patients for the treatment. We learn about the positions one by one. The basic position to learn about anatomy is anatomical position, because we'll be learning about the bones, the structures that is present in the body, its relations, everything in relation to the anatomical position. Anatomical position is where the body will stand upright, face facing forwards. The feet will be flat on the ground, directed forwards. The upper limbs which will be lying on the sides of the body and palm facing forwards. It is the normal standing position with the palm facing forwards. Next is supine position. In this position, the patient will be lying horizontally with the face and the body facing upwards. The opposite of supine position is called as prone position. Here, the patient will be lying horizontally with the face and the body facing downwards. Next is recumbent position. Here we have right lateral recumbent position and left lateral recumbent position. Lateral means sides, while recumbent means lying down. The patient lying on the right side of the body, that is called as right lateral recumbent, and the patient lying on the left side of the body, we call it as left lateral recumbent position. Lithotomy position. It is often used during childbirth and any surgery in pelvic area. The patient will be lying on the back with the legs flexed 90 degrees at the hip joint. Knees will be bent at 70 to 90 degrees and it will be rested on the padded footrest which is attached to the table. Fowler's position is a standard patient position where the patient will be seated in a semi-sitting position. The angulation will be about 45 to 60 degrees. Knees may be either bent or straight. Trendelenburg's position. It's for a patient on the operating table. Commonly, it is used during lower abdominal surgeries and central venous catheter placement. The patient will be lying in the supine position in the table with the head declined below the feet level at an angle of 16 degrees. Next is the planes of the body. These are the imaginary line which helps in learning about the parts of the body. Sagittal plane, it is a longitudinal plane which divides the body into right and equal halves. The plane will be passing through the center which splits the body into two equal halves. The parallel plane which passes through the sagittal plane is called as the parasagittal plane. This also divides the body into two halves, but it will be unequal halves. Next is transverse plane. It is also called as horizontal plane or transaxial plane. It is an imaginary plane that divides the body into superior parts and inferior parts. Otherwise, we can call it as the upper part and the lower part. Next is coronal plane. Coronal plane is also known as frontal plane. It will be vertical in position which divides the body into front portion and back portion. Otherwise, we can call it as anterior portion and posterior portion. Otherwise, it is also called as ventral and dorsal position. So today we have learnt about the anatomical position, prone position, supine position, right lateral recumbent position, left lateral recumbent position, Fowler's position and Trendelenburg position. In the planes, we have learnt about sagittal plane, parasagittal plane, horizontal plane and coronal plane. If you find this video useful, share it with your friends and subscribe the channel and hit the bell icon to get the updates immediately. Personal anatomy classes as well as coaching classes are undertaken. Students, those who are interested, can contact in the mail ID given below. I'll meet you in the next video. Bye-bye.